Hey everyone, this is Jessica, the president and founder of the Psychedelic Society of Minnesota, and for the past year or so, I've been chairing the state's psychedelic medicine task force. So we're wrapping up our work this month and finalizing a massive report that will be submitted to the legislature at the end of December, beginning of January. And so I just wanted to give folks an update on kind of where we're at and what the report is going to contain so that y'all can be ready for that when it drops at the beginning of 2025 and is available to the public. So hopefully folks have been following what the Psychedelic Task Force has been doing. There's some great videos up on YouTube. Thank you to a member of the public who's been recording those meetings. So those are all watchable if you weren't able to attend any of those live. But basically, now that the work is done, we were tasked with writing a report and coming up with official recommendations to provide to the legislature on how to create some kind of access program for psychedelic medicines here in Minnesota, kind of piggybacking on what has been done in other states like Oregon and Colorado. So we officially recommended as a task force by a 2/3 supermajority vote. So we did this through a democratic process. And so what we landed on was that the task force recommends that the Minnesota legislature create one, a state-regulated clinical program for the therapeutic administration of psilocybin-containing mushrooms. The second recommendation is to remove criminal penalties for the personal use and possession of psilocybin-containing mushrooms. So this would essentially be decriminalization at a statewide level to possess and use magic mushrooms. And then the third and final official recommendation from the Psychedelic Medicine Task Force to the legislature is to allocate more funding for research into the health benefits of MDMA, psilocybin, and LSD. And while we aren't officially recommending any other things to the legislature, in our report we did provide sort of a comprehensive snapshot of different ways to access psychedelic medicines that are equitable, culturally relevant, things like that. And so even though these recommendations didn't pass a supermajority, a lot of them did have a simple majority, meaning that most of the members did vote in favor of this, but it didn't sort of achieve the high bar of a supermajority that we decided would be needed to have formal official recommendations to the legislature. That being said, some of these other recommendations that didn't pass, but we do describe in detail in the report for how they could theoretically be implemented if and when the state is ready to do that, is to, one, remove criminal penalties for the personal use and possession of non-commercial, meaning without any kind of remuneration or sales, to be able to cultivate and share psilocybin-containing mushrooms. So really kind of a statewide decriminalization measure for magic mushrooms under this grow, gather, gift model. That didn't achieve a supermajority, but it is a potential option. The legislature is not bound by any of these recommendations, and they could put forth a bill that does include some of these. So we don't know what that bill is going to look like at this point, but these are just some suggestions that they could potentially lean on. The second unapproved recommendation that's included in the report is to remove criminal penalties for the personal use and possession of the synthetic versions of the psychedelic medicines that we were tasked with researching, which would include MDMA, synthetic versions of psilocybin, and LSD. The third recommendation that didn't pass but that was included is the creation of a state-regulated program to administer MDMA or LSD. This was not viewed terribly favorably given the complications around sourcing psychedelics that need to be synthesized, and the precursors are heavily monitored by federal agencies like the Drug Enforcement Agency. So this one didn't pass a supermajority, although theoretically it could be possible. I know that the program in Utah that was passed this year basically legalized psychedelic medicine services with MDMA, LSD, and psilocybin, anything that's been granted breakthrough therapy designation. But it's unclear how that will be sourced, and we started to realize that was a potential complication for what's called sort of closed loop or kind of within state sourcing of things that are federally illegal. We already have a precedent with this with cannabis because you can just grow it, but when it comes to kind of manufacturing and synthesizing certain drugs, it becomes a little more complicated. So that one was a little bit of a harder sell to convince people to buy into. And last, but certainly not least, one of the recommendations that didn't pass, but that was thoroughly discussed regarding issues around public safety and accessibility and affordability was creating a regulated adult use market for psilocybin-containing mushrooms, kind of similar to what we've just legalized here for adult regulated cannabis. And, this kind of was born out of the fact that there's been a lot of weird adulterated products in this kind of gray space around psychedelic medicines and mushrooms specifically. You're seeing all these mushroom chocolates and mushroom gummies that say they don't have anything illegal in them, but there was the famous Diamond Shrooms product that the FDA actually recalled because people were going to the emergency room and having seizures because people are trying to get around the Controlled Substances Act by, pumping out all these weird synthetic molecules that aren't technically illegal, but we also don't know if they're safe to consume. Similar to what was seen with all the synthetic cannabinoids when, people were trying to get around finding access to cannabis and THC. And so this kind of adult regulated use model would really kind of protect us from that. And even though it sounds crazy, would really be the safest option because there would be a regulated market. People would absolutely know what they were getting and they would understand the quality of it. So just a suggestion. Hopefully we'll get there someday. But it did seem a bit far-fetched from the perspective of several people on the task force. So it did not pass as an official recommendation. There's some other things that are covered in the task force report. It's about 198 pages. It's very long. So I'm just trying to kind of summarize the kind of high-level information that's in there. And when it's out, folks can go and read it in as much or as little detail as they would like, but it's there for your educational purposes after January 1st, 2025. So some of the main topics that we covered in the report include navigating conflicts with federal laws, performing scientific literature reviews, regulations and policies needed for access to psychedelic medicines, historical, cultural, religious, and indigenous considerations, access for U.S. veterans, public education strategies, tribal nation sovereignty and the unique nature of tribal law, what our official recommendations are. And then there's a massive appendix. It goes from Appendix A to Appendix O, talking about quite a lot of things. And so those include, the first appendix is just sort of laying out all the kind of duties that were spelled out in the actual legislation that created the task force. So what were we mandated by law to cover in our work and in our report. We also have a detailed list of our task force membership, who each person was and what their role was on the task force, kind of the logistics of our report writing process and how we came to our decisions and what we decided to include in the report. We have voting logs for each of the recommendations that we're submitting to the legislature. We have a pretty detailed section from the advice and perspective of various subject matter experts that we had come present to our task force to teach us about different aspects about the law and cultural issues and drug development pipelines and things like that. We also have a section that's dedicated to personal stories and shared lived experience with psychedelics, both from task force members themselves as well as those solicited from the general public here in Minnesota. There's a legal appendix that kind of goes over all the different federal laws that we were tasked with exploring and, recognizing that ultimately all of these psychedelics are Schedule I drugs and any sort of programs to access them would be in violation of federal law. So trying to figure out how can we reduce those conflicts as much as possible to pursue a program with a Schedule I drug, similar to how we've already done with cannabis. But there's some other considerations to factor in because psychedelics are not the same as cannabis other than they're Schedule I drugs. There's also more detailed scientific research that is outlined in the appendix, as well as the methods that were used for the scientific literature review. Also as a comparison to kind of some public health statistics that are in the kind of main report related to psychedelic medicines and their use and abuse and side effects and impacts on public safety. We have an appendix that kind of shows that same information, but for alcohol and cannabis, just as a kind of point of reference to compare, what are we legally able to consume both federally with alcohol and within the state with cannabis, and how does that track with kind of similar measures of public safety and concerns with the psychedelic medicines that we're looking at with, magic mushrooms, LSD, and MDMA. There's another appendix that's really trying to outline and describe all the efforts happening in other states. So there's a lot of bills. I think there's like 30 plus other states that are actively working on trying to find ways to pass laws to give people access to psychedelics in a variety of ways. Most of them haven't been very successful, but we do try to compile all that information as best as we can, just so that folks are aware that, this is happening at a national level, and almost the entire nation is really interested in this. So something to keep an eye on. And then we also have a section around sort of some best practices with data collection, because some of the programs being set up in Oregon and Colorado are really working to collect data so they can understand the impacts of these new kind of drug laws with psychedelics and how that impacts public safety. Is it posing any risks? Are people being harmed? Are people being helped? So there's some ways to do that we need to factor in, because like I said, these are Schedule I drugs. So a lot of the federal protections around sort of patient privacy that you normally would get when you go to a clinic to get treatment don't really apply when you're trying to access something that's federally illegal. So like most of your data that might be collected if you're in the medical cannabis program theoretically wouldn't be protected. But there are some ways to get ahead of that so that nobody's really put at risk if the federal government tries to subpoena that information or it gets hacked or something like that. So so there's a section about that. There's also a section on mushroom cultivation and sort of best practices around that solicited from cultivators in the community. And then there's a massive list of, scientific references and other resources and websites that people can look at that kind of complement the report. And it's very thorough, very comprehensive. I look forward to it being released and available to the public, and really hope that it can help inform bills that start coming through the Minnesota legislature on trying to find a way to legalize psychedelic medicines here in the state. I also hope it could potentially be useful for other states trying to figure out this sort of state-federal relationship with Schedule I drugs based on all the work that we did. And hopefully that can help other states do similar things. And it might hopefully help any conversations that are happening at the federal national level around, potential rescheduling of psychedelic medicines. At the very least, I personally think magic mushrooms are just so safe and easy to grow, and there's such a long history of use. I don't see why they need to be on Schedule I federally. And hopefully really good information from these state programs can help inspire the federal government to think about rescheduling this, as they've sort of done recently with cannabis, where the FDA or the Department of Health and Human Services, or HHS, recently did a full investigation of cannabis and its use in these different state medical programs and whether it has accepted medical use that would warrant moving it off Schedule I. And they concluded that yes, it should actually probably be on Schedule III, and the DEA is holding a trial at the beginning of 2025 to determine whether that will actually happen. So lots of interesting things happening locally and nationally in the drug policy space. So stay tuned for that. And thank you so much for listening and chiming in. And I look forward to talking more about this report and what's next.